So good afternoon, everybody. Me, Dr. Omar Alnadi, together with Dr. Ayman Zyada, is going to give a small talk about the advancement in the wound dressings. So we're going to talk about the 3D printed hydrogel dressings. As we all know, chronic wounds like diabetic ulcers, burns, and pressure sores has been challenging since ever. Many problems are we deal with in even the advanced dressings we are using daily, that they are lacking adaptability. You can't be fitting your dressing within the wound dimensions, and it's not telling you about what's happening in the medium of the wound. So here comes the idea of the 3D printed technology to be able to be fitting within the wound dimensions and achieve the complete sealing of the wound. And this is a perfect physiology for the wound reconstruction. As you can see in this picture, the hydrogel-based dressings is totally transparent. And this is a first good point about it. It's allowed the sunlight to go through. This helps a better reconstruction because it's more physiological for the wound. And it's majorly formed of water-rich polymer networks. This has a good resemblance to the extracellular matrix, so are doing something that's totally natural. Hydrogel-based dressings has been used since ever, so what's new about them is that we are going to 3D print them to be able to be fitting perfectly. And this is, of course, will give us a better outcome. Moreover to that, is that it's totally customizable. Like you can add stuff, remove stuff. It's not just the same structure every single time. You get to be changing the medium by adding growth factors. You can be adding antibiotics to this. And accordingly, this will provide better outcomes with time. Also, it allows some sort of permeability to the oxygen. This, again, is more physiological. And lastly, you can add indicators, like telling you about what's happening in the pH of the medium, the glucose level, the protein level. So you can adapt according to this. The bad point about this is that it's not totally standardized. It's still in the beginning. It's a potential future for the wound dressing. Many problems with it. And there are many studies talking about this, as you can see here. Now let's go to some details by Dr. Ayman Zyada.
Thank you so much, Omar. So most of these are actually still under investigation studies. There's no proper human-based randomized controlled trials so far. So there are what we call now as a next generation smart 3D dressings. These dressings might have pH sensor, photosensor, glucose sensor, or temperature sensor, and they give actual time-based data about the wound condition, whether it's more acidic, which might indicate infection, also increased glucose level might indicate the need for optimal diabetic control, or even temperature might indicate an infection. Apart from that, it gives us this data as a wireless transmission to multiple methods, whether Bluetooth or NFC or other kind of systems. For example, Stanford wireless smart bandages are under investigations now in the USA, and this is like a microchip-based dressing. Also, some of them has a controlled drug release. They can inject medications directly inside the wound. For example, some nanoparticles which are pH sensitive to change the pH of the wound, or antimicrobial like gentamicin or silver. Also, water absorption, hydrofiber to reduce the moisture inside the wound itself. So that's the coming future, actually. Some challenges we should be aware are the cost. Most of these drugs, or these dressings, are costly. That's why there is a delay as well in the clinical validations. While on the other hand, if we look at the future perspective, it's cost-effective material and using of AI integrated systems. So as a take-home message, we should focus actually on the importance of the coming future smart dressing that would reduce the need for wound dressing change and will increase our ability to monitor our dressings and give it the best optimization for healing.